So Louise, how are you recovering after birth?
Definitely at this point a lot better. There was a couple of weeks of definite recovery where I was needing to sort of use painkillers and things, and then that's kind of tailed off over the last couple of weeks, and I've noticeably sort of when using the toilet and things, I can tell that things are a lot more back to normal. I don't have sort of stinging of where my stitches and things were.
So did you have a vaginal tear during your
Yeah,
birth?
I did. I had a couple of tears. I think one was sort of more external towards the back, and then one sort of internally as well.
So I'm just going to talk you through the different types of tears, because it sounds to me from what you're describing that you've had a second degree tear. We would classify it as. So this is your pelvis.
Yeah.
Okay, so this is down here in us. And this is the pelvic, these are the pelvic floor muscles.
Yeah.
Okay, so you've got two sections just sitting right at the base of the pelvis.
Okay, that's interesting seeing the two sections.
Absolutely.
For some reason I wouldn't have thought about these at the front actually.
Yeah.
More about the internal.
Internal bit,
Yeah.
absolutely. So what I'll just point out, so you've got your urethra here where the urine comes out.
Yeah.
You've got the vagina here, and then this is the area we'd call the perineum.
Yeah.
And then you've got your anus as well. So you've got two circles of muscles around the anus, which we call the anal sphincters. Okay.
Yeah.
So in a second degree tear, any of the kind of pelvic floor muscles can be torn.
Right.
You might see the stitches outside, or they might actually be inside the vagina. You wouldn't necessarily see them, but you would still feel them as you're expressing.
Yeah, so I definitely, one of the tears was inside and then the other was more on the outside. Somewhere.
So a first degree tear would not involve any stitches generally. It's more of a graze to the outside skin and the tissues.
Yeah.
It can include the labia. So that's a first degree tear. The second degree tear is what we've just spoken about. Would also include an episiotomy, which is sometimes what's needed to be done by either a midwife or a doctor, to the side.
Right.
And it's basically just to allow a little bit more space for the baby to come out if, say, the baby was distressed, or if you required a forceps delivery. Though that's times that generally they would need to do an episiotomy, and that's in the same classification because it involves the pelvic floor and would involve stitches. Okay. Third and fourth degree tears are slightly more than that, and they involve some of the muscles around the anus. Okay, the anal sphincter muscles, those two rings of muscles around the anus. So those are your different classifications. So you touched on a few really good points. So what we recommend, if for anyone who's had a tear, in those initial stages when you're going to the toilet to pass urine, it can sting. So we generally say take a little cup of water and just try and wash the area straight away afterwards, kind of to prevent that stinging. It's also important to keep the area clean, but we also don't want to over clean the area because we want to allow the body and the vagina its own time to heal. So we'd generally say don't use any scented products, nothing in the bath, no bath salts, but it's okay just to have water, so you might want to use the shower head to just wash the area, but just be using water.
That's what I was advised to use the shower head. But to maybe not sit in the bath for the first week at least. So that the stitches didn't dissolve so quickly.
It will depend on kind of every place uses different stitches, but that's kind of a really good point. We just don't want anything scented or bath salts or anything like that might impact on the wound healing. As you say, it can be very uncomfortable and you sometimes need painkillers. And it's really good advice to take those, especially for the first few weeks when the swelling is the most. Something that can help with swelling is to use kind of ice packs for the area. And the simplest way to kind of make your own would be use a normal sanitary pad that you'd use during a period and actually wet it with water. Place it in the freezer so it makes a little ice pack. Absolutely. Now it's very important when we take it out that we completely cover it, whether that be in a flannel or a towel, an old towel that you don't want anymore, before you place it like you normally would a pad. And you'd place it there for probably about 10 minutes. And you can repeat that kind of every few hours, which can just help to reduce the swelling. Any wound we have, you'll get swelling, and that creates pain. And the ice and the cooling can just help to reduce that.
Great.
In sitting, it can be quite uncomfortable if you have a perineal tear because there's a lot more pressure on the perineum. And what we'd recommend is that you get two separate towels and roll them into kind of two sausages and place them down on the chair. Put them under your thighs so you're totally lifted up.
So one under each leg.
Absolutely. So there's no pressure on the perineal area or the healing tissues, especially if there's some swelling there. that can generally
that sounds good.
be a
That
lot
would have been
more
really
comfortable.
useful to have thought about.
Absolutely.
Could you perhaps even use 2 cushions on either side of you,
You
if
could
you're
do.
in your sofa or something?
Absolutely. It's trying to play around, and what you're trying to create is a way of sitting that's no pressure on the perineum.
Yeah.
We generally just find, because towels are more rigid, they
Yeah.
lift you up a little bit more effectively than a cushion.
Excellent.
But it's kind of whatever works for you and you've got available at that moment.
Yeah.
Did you have any problems with your bowels afterwards?
I was nervous, I think, as probably quite a lot of people do feel.
Absolutely.
But I think as you get your first poo out of the way, definitely you kind of are less scared, even though it's not the most comfortable thing. And then as healing gets better, as you heal, you can become
easier.
It
You've made
becomes
some
easier.
great points there. I totally agree. I think it's really important to try and think about, especially if we are breastfeeding, sort of 2-3 litres of fluid a day,
Yeah.
and really focusing on water. Sort of teas and coffees can dehydrate us,
Yeah.
especially when they're caffeinated. So it's important we're taking on the right fluid, and as you say, the right food. Thinking about our fruit and veg, thinking our fibre can help loosen the stool to make it easier. Some women like to kind of take in a pad and actually splint the perineal area.
Yeah.
So thinking about this section here, they might want to splint and hold to support the area where the stitches are as they're going to open their bowels
Yeah, I
for the
did try
first few
that.
times. Brilliant.
Yeah.
Which can just give you a bit more confidence and also confidence and support. But as you say, and it's very important when you get that urge to go for the first time, don't ignore it.
Just go
to
with
try
it.
and go and listen to that urge.
It is kind of it. I think it's less bad than what you think. It's just the thought is probably
Of
like labour
course.
itself. The thought is worse than
It's worse than
what
reality
actually
at times.
happens.
Completely. And that's a very good point. And you may feel initially that you are going to the toilet more often, you're drinking more, and sometimes you don't feel like you can hold it as well, which is quite normal. And that's when we would want to bring in thinking about starting our pelvic floor exercises,
Okay.
starting to use those muscles again, which can help us with our control.
Okay.